Good morning. I hope we're live on YouTube, and we've got a few hundred people viewing currently, so that's great. My name is Liz Harris. I am the Head of Professional Standards for the College of Paramedics, and welcome to this Student Paramedic live Q&A panel with my colleagues from the College of Paramedics and various other organisations. We will come to some introductions in just a moment. Firstly, welcome to you guys. So in order for you to ask us questions this morning, we need you to sign in or log in to the YouTube. I'm sure many of you have done already, and I can see lots of comments coming in now, so that's fantastic. I'll try and keep my eye on the questions. I'm probably not going to get round to them all, but we'll do our best, and we will collate them as well, and maybe hopefully answer some after this hour of live chat has finished. So if you can all kind of get signed in, get logged in, get the availability to ask us questions while we move on with our little bit of intros. We are recording this, so hopefully we will be able to release this quite soon for those of your colleagues that didn't manage to watch this morning. Thank you for joining us, and a big thank you to NHS Horizons team for helping us with the tech and the platform and all the background work that's gone into doing this chat for you this morning. Okay, so we'll start off with Ben. Welcome. Good morning, Ben.
Hiya. Yeah, so my name is Ben Vickers. I'm the National Student Representative for Student Paramedics as part of the College of Paramedics. I'm one of the second years at St George's University of London. So I really wanted to encourage everyone to ask any questions that you can think of. You don't have to use your real name, you can use a pseudonym, just use your Google account for that. We are going to try and get through every question, as Liz says, but this event really is about students, so we do want to get as many questions as we can. So if you have any questions at all that you want to ask, please do ask them, because there could be someone else who wants to ask them and just hasn't yet, or anyone who's not able to attend today and wants to watch it later.
We move to you, Bob, and then down through the list of panel members, please.
Hi, good morning. I'm Bob Fellows. I'm Head of Education, College of Paramedics, and I'm delighted that we've been able to get technology to pull so many people together into one room, obviously 2 meters apart. Hopefully we will do our very best to give you some answers, and if we can't give you the answers, at least some guidance. And we're looking forward to interacting with you this morning. It's going to be fun.
Caroline, we're waiting for you. Dave? Dave, let's move to Dave.
Good morning. My name's Dave Revoir. I am a pharmacist and paramedic. I am the Specialist Medicines Advisor to the College of Paramedics, Trust Pharmacist for East Midlands Ambulance Service, and also an operational paramedic for East Midlands.
I think I'm next. Good morning, everybody. Gary Strong, National CPD Lead for the College of Paramedics, working very closely with Liz, Bob and Tracy and Julia and the rest of the team at the moment on all manner of things to support members and especially student members. So welcome, everyone.
Ian, are you with us?
Good morning, everybody. My name's Ian Teague. I'm South Central Ambulance Services Assistant Director of Education, and I'm also the National Education Advisor for the College of Paramedics in England.
Hello, everyone. I'm Julia Williams, and I am the Head of Research for the College of Paramedics. You probably will have seen me plugging a study which Liz is going to talk about a bit later on. I also am still doing my clinical with South East Coast Ambulance, so I'm here from both perspectives today.
Morning, everybody. My name's KatiePavoni. I am the course director for the BSc in Paramedic Science at St George's University of London. I'm also the pastoral lead there, and a member of the College of Paramedics Mental Health and Wellbeing Steering Group, as well as being a paramedic myself. So good morning, everybody.
Good morning, everybody. My name is Kirsty Richardson. I am currently working as a workforce transformation lead for Health Education England in West Yorkshire and Harrogate. As part of that work, I'm currently working with North Eastern Yorkshire region on the mobilisation of paramedic students. I'm also the Vice Chair of the Education Advisory Group and of course a paramedic. My day job is I'm based at Yorkshire Ambulance Services lead paramedic.
Good morning, I'm Vince Clarke. I'm a paramedic working at the University of Hertfordshire as the programme lead there, and I'm also the trustee official for education for the College of Paramedics. I've got experience as an HCPC partner in a number of roles. That's it, thank you.
Morning everyone, Will Broughton, I'm Director of Professional Standards for the College of Paramedics, frontline paramedic and teacher at the University of Hertfordshire as well.
Caroline, do you want to do your intro?
Can you hear me now?
Yeah, there we go, go for it.
So second attempt, good morning everybody, my name's Caroline. I'm a paramedic and I currently work for Health Education England. I'm here to look at how we can mobilise the student paramedics safely into the temporary register.
Thanks, Catherine. Before we move to our Chief Exec, we've got John Martin with us this morning.
Liz, I had to give his apologies. He's had to take an urgent phone call, but he will be back.
All right, okay. So we might hear from our chair, College of Paramedics chair later. So finally to you, Tracy. Thanks, everyone.
Thanks, Liz, and thanks, everyone. You're most welcome this morning. This is arguably one of the most important things we've done so far in the College of Paramedics, because you are our future. You are the future of our most beloved profession, and we're delighted to be able to give you this forum today. So please use all this expert panel for any questions you have. I'm going to leave it there because your questions are far more important than me speaking. So you're very welcome.
Thanks, Tracy. So hopefully you got a good idea about who you're talking to. And I can see one question that's coming in, and there's lots of intros on there, people saying hello to each other, lots of different students from around the country, which is amazing. So shall we go straight in there with quite a topical subject, because it's on the back of some guidance that was released yesterday, Bob, which you'll know very well in terms of the HCPC statement. And so we've got a question that the HCPC is saying that we will, so I guess this is a third year student paramedic, we will be band 5 clinicians, but CCAM are talking about doing AAP ECSW roles, and there's confusion out there from certain student paramedics. So have we got some advice and some clarity on that, Bob?
Yes, the HCPC statement on their website is the same statement that was written by the Chief Allied Health Professional Officers, the CAPU statement, which was signed up by also the Council of Deans. And the indicative pay bands were that if you were on a temporary register, you would be on band 5. And the support roles, ECA or equivalent, I don't want to get tied up too much with the titles of these, would be on band 3. We know there is some different services doing some different things. We know that some people have been taken on to do technician roles and have been offered band 4, but that is the advice and guidance given by the sort of the leaders within health to try to stop people only wanting to do a certain job just because of pay. The college has followed that line. We are not the employers. We don't set the pay bands, but it is reasonable to think that if you are on a temporary register, and with the responsibilities of a paramedic, then you should at least be paid in proportion to those skills and responsibilities, and also the risk factors that you're taking. So that seems fine on band 5. And the support roles, well, you know, I suppose it might vary around the country, but band 3 seems about right. If you're in a backroom task where you're non-clinical patient facing, perhaps you might expect to perhaps only get a band 2, but their variants are all over the place. So I hope that gives you some guidance from us. We don't set the pay, but we are encouraging some alignment with the national views on this. Thank you.
Brilliant, thanks, Bob. And the temporary register, so we've got probably 70 odd, am I correct in thinking, student paramedics on the HCPC temporary register currently?
There were 75 listed the last time we did a count. They were predominantly made up of 2 universities. I think others will have been added since then. And there were a few from one of the private providers. And people were moved to a temporary register if they had, in their last 6 months of their course at year 3 or year 4 in Scotland, and they had completed all their clinical placements, and the university's leadership team had deemed these people as suitable to move to a temporary register. Just because you were placed on the temporary register did not mean you had to follow that alignment. You could say, no, I don't want to do that, but that's the standing at the moment. The same as anyone returning to the register with a 3-year gap were placed on there, and we had around 1,600 paramedics out of the 20,000 allied health professionals who returned to the register. Some of them will take up the opportunities and some would say thank you, but no thank you. It all was a matter of choice. So yeah, 75 is about right from the last time we did a count. I suspect it may be a little higher. We don't expect it to double or treble. Very few students were actually ready for the temporary register. Several universities I spoke to said they were preferring to push forward with completion of the last year students to get them ready for the full register when that was ready and available.
Thanks, Bob. Vince, just thinking about whether you had anything to add to that, you know, from a HEI university perspective.
I think it's, as Bob said, it's up to the university to think about their students and their program, and whether those students are ready to go out immediately, that they've finished their final placements, or whether there's more work to be done and they're that near the end of the program that to interrupt that work would seriously disrupt their progression. So taking those decisions on board, that's where the universities have decided how to progress their students and whether or not they're being placed on the temporary register at this point. And that will be different for all programs. They all follow different timelines, they do different things at different stages. So it's not unusual that only a few universities have put students on the temporary register.
Yeah, and I think I'm going to come to you and maybe ask you for any other comments on that subject that Bob and Vince are talking about there, but also maybe starting to introduce the next question, which will be probably about driving. So any comments first, Ian?
Yeah, just to add to Bob's comments, it is up to the employer to work with their local universities and ensure that students meet the requirements. The universities are best placed to guide students and to trusts. It is up for local employers to negotiate what they feel is appropriate deployment for each of the year groups. And the college statement, I think, is cognizant of all of those different skill and experience levels. I think I'm not specifically aware of the driving question as yet, Liz, so if I may, I'll just pause there and wait for something specific around driving rather than try to cover it generally.
Yeah, of course. Yeah. Of course, some student paramedics will already have a C1 and some do not. So I'm assuming ambulance services are taking that into consideration and utilising student paramedics that have a C1 appropriately. I think some of the questions that are being raised from our student colleagues are that DVLA has cancelled all driving tests, the medicals for the C1s are proving difficult to get currently. But what about some kind of emergency tests or emergency medicals for key workers? Have we got any information about that at all?
Yeah, absolutely. C1 has been complex. Many ambulance services have been able to negotiate locally in order to open up theory tests and also practical tests. And there is government lobbying going on about how those practical tests can be completed. But the DSA, Driving Standards Agency, have allowed ambulance services to make use of fire service and police service theory and practical test setups. One of the main complications is around the application of the C1 provisional license. So if students had not applied for their C1 license prior to the lockdown, it is highly likely that their application is sitting on a pile of letters to be opened by DSA when they return to work, the DVLA when they return to work. However, there has been a lot of negotiations around how they can progress C1 provisional for emergency service workers, including paramedics, and we hope to hear soon whether they have been able to do that. But that's the main problem, the actual C1 provisional license. Most trusts have solutions for their theory and practical tests for students that want to come through. Thanks,
Ian. I think if there's any other queries around that, people can ask specific questions in the chat, and we'll come back to that.
Should I just add something there that some of the ambulance services have got a greater quantity of driving instructors than others, and so are able to offer driver training. Southwestern has been one of those, and that others have decided not to be able to, in this short term, take clinicians off to actually undertake blue light driver training. So they're trying to facilitate clinical placements without undertaking the driving. It varies all over the country. So I don't think we can give a direct answer on it.
So a specific question here from a second year student. We have been confirmed that our outcomes still left to sign off will be taken over to the next year. However, due to my hospital placements, I have nearly 40 outcomes still left to do. So this student paramedic is worried that they're going to be so left behind. Do you have anything to say around that, Bob?
Well, I think universities are trying very hard, and I think most of them set up within a 1 week period to do online training and development. Some of the big challenges I've been discussing with 1 or 2 universities has been how to undertake some of the more complex practical assessments, and they're trying to come up with clever ways of resolving that. I was hoping that most universities would not push the competencies and the outcomes into the following academic year, and it's one of the reasons we took a stance as a college and encouraged the right level of balance between practical out on the street and also carrying on with your academic studies. It is important that students, if it is at all possible, can complete each year group to have progression, and that there isn't massive delays and we push everything into next year. We do have to think in the longer term about resilience, and I think the individual student will need to discuss that with their HEI.
So on that, we've got a couple of HEI people on with us, haven't we? Katie, do you want to say a little bit about what you're doing in terms of supporting students and that worry that obviously lots of them do have?
Yeah, absolutely. And I can completely understand why that can create quite a lot of anxiety for students. And I think just to take this opportunity to reassure from a university perspective that we're doing everything we can to make sure that you are not in any way disadvantaged, and that we can make sure that we reach those outcomes in creative ways. And sometimes it takes a little bit of time, as there's, important that we achieve sort of rigor around those assessments or methods of progression, but we're working really hard behind the scenes. And I can assure you from St George's perspective, and I'm sure I speak for all the HEIs, that you as students are at the heart of that decision-making process, and how we can make sure that you have everything you need to progress, and that worry sits with us to be able to progress you. So I can completely understand why lots of people feel worried, but to let us carry some of that, and that we will hopefully come up with the right strategies to move you forward in these very unprecedented times.
Thanks for that reassurance, Kirsty. Vince, do you want to add anything from your university perspective?
Yes, I think to reiterate what's already been said, it's up to the university to make sure that the students are still achieving what they need to achieve for the HCPC registration at the end of the programme. Because of the circumstances, programme leads such as myself have been given a little bit more leeway than normal to make adjustments within the programme. Those adjustments can be around assessment, they can be around placement. And one thing that is a hangover from the old days of endorsement and approval is the number of hours that people are required to do on placement. The college doesn't have a position on hours, and we tend to focus more on learning outcome and achievement of objectives in practice rather than the accumulation of hours. So one of the most flexible things that we've got, particularly at my programme, is to review students' progression on a case-by-case basis, looking at how they've achieved in practice and what they've done, rather than how many hours they've been out in a vehicle or on a ward setting. So that's one of the approaches to flexibility. The progression between one year and the next doesn't necessarily need to be based on the achievement in placement, depending on the changes that can be made within the programme. So again, there's flexibility there that the programme needs putting in place to make sure that anyone that moves on to the next year is appropriate to do so. And hopefully the type of areas that aren't being covered now will be inherent in the following year anyway, rather than being additional burdens to achieve in placement.
Thanks, Vince. And can you provide some further guidance around the student paramedics that are joining the temporary register, but are also obviously not far off being fully qualified and joining the permanent register, and how that temporary registration might affect the completion of their course and moving towards full registration?
Yeah, that's a slightly more tricky question to answer, because all of the programs are different, as we've seen before. Thinking of my particular program, my students who are in the third year have recently completed their final placement, but they'll complete their written submissions and dissertations and the remainder of their academic work within the next 3 or 4 weeks. So the decision that we've taken as a university was to support them to achieve that and complete that work, so that they can then complete their studies and apply for full registration. That doesn't stop them working at a support level if they have the capacity to do that in the meantime. But anyone that does join the is put on the full the temporary register at this point, they will have to complete their studies so that they can then go on to the full register at a later stage. And that's going to differ between all of the different university programs, depending on the amount of work that's left for those third years to do and how that sits in their year plan. And that's going to be something that the individual universities will have to put in place, and the students need to be mindful that they'll have to go back and complete their education once the temporary register is closed, and they need to be in a position to apply for the full register.
Thanks. And I'm coming to you, Ian, for a little bit of a follow-on to that, and then potentially Kirsty and Kaz from the employer perspective, because there is a particular specific question, Ian, on the chat around how joining an ambulance service, SCAS in particular, as a temporary registered paramedic, how will that affect a full-time post-qualification and full HCPC registration, or will it affect that?
I can certainly talk about my own trust specifically, but obviously there are other trusts which may do it slightly different, so it will have no effect. Temporary registration for student paramedics will lead to permanent employment with our organisations for as long as the individual would like to work with herself. Clearly, temporary registration is a voluntary activity on behalf of the individual. So although they might be put on the register, they don't specifically have to seek employment. But for those that have in our particular region, they have been put onto contracts which will enable them to continue study. We've got robust mechanisms to ensure working hours are supported, monitored and fed back to allow students to be able to continue work efforts. And in our particular area, as I know a couple of others have, there's been changes to the clinical validation line to provide additional support whilst students are undergoing and working as temporary registrants. But I do see the process as being seamlessly moving from temporary registration to full registration, although I must confess to not understanding the semantics of that from a HCPC perspective, but I see no problems that throughout the country if students wish to do it.
Thanks, Ian. Can we take the focus a bit more north then, girls? So Kirsty, do you have a follow-up comment to that?
So yeah, really just to echo what Ian's just articulated so well. So we're seeing similar processes up here in the north in terms of the temporary registered students being welcomed into the trusts on a robust induction programme that's supporting them with the additional support as outlined by Ian via senior clinical support cells, for example, in Yorkshire Ambulance Service. In terms of what that means for their future once they're fully registered, there is no specific outline there, in the sense that they would still just follow the normal processes, and they can stay with the trust working under the criteria of the temporary register for as long as needed. That is entirely voluntary. They can withdraw their services at any point in terms of that, and there's no recourse from that. They're supported to continue with their studies and continue to have clinical supervision as required to ensure that all that they need is provided. And then once they're in a position to join the full register, as I say, the process will continue as normal, and the recruitment and employment will just happen as it would do in the normal way.
Caroline, and you want to add to that? I think you might have some support.
Yeah, I think my primary message to everybody is that if you haven't been put forward for temporary register, or your university decides that they want to get you up to full registration, please don't be disheartened by that, because from an employer perspective, from HE's perspective, and from a system-wide perspective, we need to ensure that we've got a continuous flow of people coming into this workforce. We know that this is going to be a protracted incident. We know that we're going to lose staff through sickness for a prolonged period of times. So ensuring that we have people coming in, in the next few months is really, really important. So that's my key message there.
Thank you. Yes, very supportive words. Thanks for that. And I guess that theme of support will go on through this question. So we've got a chap here. So can we clarify what protection will be available for students who choose to join the temporary register? So they're already on it really, but what that's saying is they choose to practice as a temporary registered paramedic. There's absolutely no obligation, just because you are on that temporary register, that you have to practice as a temporary registered student. Please do not feel obligated, peer pressured, or a sense of obligation or guilt if you do not practice as a temporary registered student paramedic. But the question relates to around support, and at present it states that we would be immediately removed from the temporary register if a complaint is lodged against us. So I'm coming to Will, but this chap is right. That's what the HCPC are saying. They have set what they call a necessarily low bar. And if a complaint is raised against you and it meets the HCPC's triage test, then around misconduct, then they can remove you from the temporary register. So Will, what's our comments on that, please?
Yeah, so in the very unlikely event that a complaint is raised against a student who's on the temporary register, and as Liz said, if it does meet the HCPC triage test, then they'll be taken off the temporary register, and the HCPC will then consider that when that student completes their full period of education and goes forward to join the full register. There's no suggestion at the moment that any complaints that are made during the temporary register process will stop or completely prevent any student from joining the full register. You've still got your education to complete, and that bit's really important. And in that unlikely event, as a student member of the College of Paramedics, you've got the full support of our legal team to support you through any challenge to your application to full registration with the HCPC. So I must stress, in the very, very unlikely event that happens, and you are a student member of the College of Paramedics, then you've got the full support of our legal team to support you through any process that might have an impact on your ability to join the full register. but very, very unlikely. And we're absolutely behind you if you do need any support, and just get in touch with anybody at the College of Paramedics, and we'll give you as much support as we can.
Thank you, Will. I think goes without saying there's a little plug there, isn't there? I'm not sure how many student paramedics that are on this live chat are actually members of the college. It's £2.50 a month, only £2.50 a month. And we are doing all we can to support you. So if you're not already a member, probably would be a good time to consider the benefits of that for you right now and for your future careers. I'll probably just go into a little bit of the mental health aspect now then, actually, while we talk about that, because it is very challenging times for all of us for many reasons, and student paramedics are putting themselves forward to go into new roles and roles earlier than they would have done previously. Katie, do you want to talk to us a little bit about that, please?
Yeah, absolutely. I think, you know, the key thing to remember is in these really difficult and uncertain times that everybody deals with things differently. So there isn't really a right way to feel, and that how you feel is absolutely valid. And just to stress really to be kind to yourself, you're human, and that to be honest about if you are struggling is really important so that you can access the right support. So, you know, keep those connections, keep talking about how you feel. And, you know, just to re-emphasize, particularly from my university and where I work, you know, we're still here to support you as students all the time that we're working alongside you. So your tutors, I'm sure, will take that same stance in making sure that we are here if you need to talk, and that you can still access those support services. So I would say keep connecting, keep talking, and remember to look after yourself physically if you can in these really difficult times. You know, sleep as much as try and get good sleep, rest and eat, and all those things to ensure your good physical and emotional health at the moment, and to not be hard on yourself, and just be kind to yourselves. And there's lots of people around you to support you.
Do any of the other universities on the call want to comment about what you're doing? Vince, are you doing anything specific to support your students?
We're trying to keep communications open with them so that we can let the students know what's going on. So each year group is being contacted when anything changes for them, so that they know what opportunities are available for them to access both support and employment opportunities as well. So we're keeping all lines of communication open. Our personal tutor system is still in place, so students can contact their assigned personal tutor for any discussions at any time. And we're making use of the technology and having, when we need to, we're having Skype meetings, Zoom meetings, one-on-one with students as required. So we're maintaining the support as best we can.
Thanks. The college has done quite a bit recently, put out on social media around support services, links to various wellbeing free apps that have all been made available. So please do have a look on our social media platforms for the links to those. And another way of getting through this is kind of sharing what you're experiencing and your thoughts and feelings around this. So I'm going to go to Julia. Julia, do you want to talk about your Cara study just briefly, so that the student paramedics can appreciate that their opinions are absolutely valued at this time, and we'd like them to contribute if they can.
Yeah, I would. Thanks, Liz. I'm actually hopefully just putting up the flyer so that people who are not sure what it is can have a read while I'm just saying. So the Cara study is the COVID-19 ambulance response assessment study. So this is a piece of research, and if any of my third years are out there, no, you're not getting out of research because of COVID-19. So just moving on from that. It's really important that we get a student perspective on this. This study mirrors a study that's called the CERA study that's being done by medics, but it was based in hospital. This one is around paramedics, student paramedics, and this is in any setting. I know the title says ambulance response, but that's the acronym, but it involves any paramedics outside of the ambulance service as well. But it also involves other ambulance service personnel who are involved in direct contact with patients. So either face-to-face in this infamous front line, or actually remotely. So people in 111, 999, all those sort of EOC, EAC, CCC, and it does depend what country you come from as to what you call it. It's about getting their experience over 3 phases. One is in the acceleration phase, we call it, running up to the peak of the pandemic. Then you'll get another questionnaire during the peak of the pandemic, only a brief one though, because quite clearly we need to, as everybody said, be looking after everybody's physical and mental health and well-being, so not overburdening people. And then we'll also be doing a slightly more in-depth exploration on the deceleration phase when we're finally told we're through the peak and numbers are decreasing. The importance of this is for now, actually, not just at the end, although that is going to be really important about shaping the future of how we respond nationally to something like this again, because I think we can say people are doing fantastic work, but there are so many different things going on up and down the country that it can be quite confusing. And that's not just in the ambulance service, it's in all areas of healthcare. So please, if you get time, it takes about 10 minutes. The links are being tweeted. I believe that Liz, as we speak, is doing a massive media push on this. This study is only open for enrolment until midnight on Friday. We may extend that slightly because if anybody's been looking at the statistics, actually the peak of the pandemic was predicted to hit London and the southeast this weekend, but actually successfully, I guess, they have delayed that. But for now, let's say it is going to finish at midnight on Friday. It looks at your experiences, your preparation. It looks at, interestingly, also your mental health. So within that, there is something called the General Health Questionnaire, which is a 12-point scale looking at how you're feeling. So that's also important so that we see and we track people throughout this pandemic. When I said it's for now, what we have committed as the College of Paramedics is that when this closes on Friday, there's a team of researchers who have already started analysing the data, because some of the things that are coming through, the suggestions that paramedics and other people are making towards managing this pandemic are really good and strong. So we have committed to analysing that within 10 days and getting it out to the government, employers, any other organisations that are involved, because some of these things that people are talking about now may change how we deal with things in the next 12 weeks. So it is a myth to think research will only change things 5 or 10 years in advance. So that's my plea, really. It's your chance to have a say. Let us know what's going on. Let us know what your ideas are. I know that PPE has been a really big issue for students through to senior clinicians. There are obviously questions on that as well, but it is not just a study around PPE. So please do get involved and fill it in. Oh, and it's not a competition, I know that, but I would like to tell you that the medics survey closed with 6,000 responses. So far, we are on 2,752 as of 3 minutes ago. So help us.
Come on, guys. Yeah.
Thank you very much. Thanks, Liz.
Thanks, Julia. Yes, it's gone out on social media again just now, and I'm going to put a link on the chat to the survey right now for everyone to click on when we've finished. And we'd also value any feedback on this chat as well. So there'll be a link on there if you would give us some feedback. It's the first time we've ever done anything like this. So just a very quick 5 minutes of, did it help you? Was it beneficial? Should we do it again? That kind of thing. Right, okay, so back to questions. I have one here, a bit of a change in subject. So Gary, maybe one for you. Where can I access CPD courses? Is there websites that you can recommend that end with a certificate? I know you'll have something to say about that, Gary.
Yeah, thanks, Liz, and thanks for the question. It's really encouraging to get questions about CPD at this time. We've got a small CPD team at the college, and we got together virtually very early on in this and said, you know, what might be useful to paramedics, to students, to associate members, to anybody at this time when, you know, arguably nobody's got any time to do CPD. How can we make it really accessible? So there's quite a lot of stuff going on, and I'll try and be fairly brief. Students, you're welcome to contact me if you are unsure about where to access any of this stuff. But we started with a podcast series, and I would, if you like podcasts, if you're a learner who likes listening to stuff while you're running or driving to work or whatever it is you're doing, the College of Paramedics Paramedic Insight podcast series is a new series. So we've done podcasts before, but what we've done with some fantastic help from member Ben Watts is launch a series that's trying to be as relevant as it possibly can be for the COVID situation now. And there are 3 podcasts on there already, one of which is really particularly deals with the issue of human factors in when you're wearing PPE, and we'll be promoting that one some more over the next few days. So that's the podcast available to everyone. On our own members only CPD hub, we've just started a mini lecture series. Some students will be familiar with Amy Yarrington, who is our lead for all things maternity. Amy is a dual qualified paramedic midwife, and her first lecture on managing maternity cases during this really challenging time is on the hub now. And I can also say that I've just tried it on a brand new website. You can do a little reflection on that and add that to your personal membership page of the college to keep the reflection for your portfolio. If you want to download that in a Word format or a PDF and put it in your university portfolio, you can do that as well. So that's really good. And that's kind of my answer, part of my answer to the question about certificates, because certificates are great, but actually they don't really tell you or anybody else what you learned from the bit of CPD that you did. So I would encourage you all to think about quick 5-minute reflections, which actually say more than a certificate. We've got a template for that. They'll be coming out soon. But just, you know, if I watched a video, if I listened to a podcast, if I went through some online learning, what did I learn and why? Now, some offer certificates and some don't. The last thing I will mention for now is our contribution to Health Education England's e-learning for healthcare hub. Tumbling over my words there. Again, look that up, Google it, and if you haven't got an account, you can start an account with a .ac.uk address, a .nhs.uk address, or through the college. And we've got 10 modules for paramedics there that are also very relevant, and we're also adding COVID-related stuff. I think I should stop talking. There's a lot of CPD available. Contact me if you need more.
Yeah, in a nutshell, but it's good to say more than just those half a dozen words at the end there. Thanks for that, Gary. Ben, are you still with us there? Have you got any comments on what we've been talking about so far, and any ideas about what your student colleagues will want to hear in addition?
Yeah, I think it's really important to reiterate that the temporary register is optional. You may still be on it, but there's no requirement for you to take any work if you don't want to. And the fact that it's a national problem, so any problems that students are having with regards to the course being delayed, any anxiety or that kind of thing, it's something that all students are likely to be experiencing. And as the university people on here have said, courses are still going. It's important to keep in contact with your course and all the people on it, and make use of any offerings they have for support, both mental health, well-being, all of that. It is a difficult time, and no one is denying that at all. But there is things that people can do. The CPD that Gary's just mentioned, volunteering to help out, it's all important, but try and make sure to keep yourself looked after as well. It's very easy to over volunteer. It's very easy to feel that you need to do above and beyond what you're capable of. And that's really important not to do. You need to maintain yourself. You need to be ready for when studies restart and ready to go into the ambulance service at the end of the course.
Thank you, Ben. I'm sure you would have had Saskia with you today, wouldn't you? Who is your alternate student representative? But I'm told she's doing she's on her ECA course. Is that right?
I believe so. I believe, yeah, she's with SCAS at the moment, completing the first part of her ECA course.
Dave, our medicines lead, there's obviously, I'm not noticing any specific questions around medicines at this point. It's more just the process by which students are going to move into different roles, and also their anxieties around their delays and their impact on their ongoing education, which we'll probably come back to. And Tracy, I'm sure that you will be speaking about that later in terms of what the College of Paramedics is doing more at a national level to try and minimise any negative impact on students' education. So we'll come back to that. But David, would you like to share some of your thoughts around some of the medicines issues that people have been bringing to you in the last few weeks?
Certainly. So part of the plan to support people on the temporary register with regards to medicines, because obviously, as I'm aware, a lot of student paramedics, temporary registrants will have not had much experience in the way of administering medicine. So one thing that the college is currently doing is we're preparing a online training package for just to highlight issues around legal aspects around morphine, its use, its recording, when you can and can't possess it, and any record keeping that's needed for that. We're also looking at providing kind of video training and education for things like mixing drugs and administration of medicines that require to be mixed prior to administration. The other thing I'd strongly encourage everybody, every single ambulance trust has a pharmacy team that works within it. You often won't see us because we usually work behind the background, but we are available there as a resource, and we generally work quite carefully with training and education. I'd strongly encourage everybody to make sure that any drug they're administering that they are familiar with, make sure that you use your GR Calc to double check things. Despite the fact I am a prescribing pharmacist and a paramedic, I still check GR Calc before any medicines administration. And if you don't feel happy about a medicine, then please seek some further advice from people. There's lots of people available in every trust to help support you with that.
Thanks, Dave. I see that we've got John Martin has joined us. So John Martin is the chair of the College of Paramedics. Is there anything that you will want to add at this point, John? Some reflections on the conversations? I'm not sure how long you've been with us, but thank you for joining us and showing students the level of support from the organisation.
Hi, I've only just been on for the last 10 minutes, so good to hear about CPD opportunities. And I think recognising that we are in the midst of a pandemic, I'm joining late because I was doing a call around COVID for my NHS organisation. I guess I'd just say at this point, thank you for all you're doing as students, wherever you are in your programme. And as a college, we do really want to support you in this. This is our first venture into Zoom and getting alongside you. So do make use of us. And if you're not a member, would absolutely encourage you to join.
Yes, you'll be good to know that we've already plugged the £2.50. Absolutely less than a price of a coffee these days to join. There are other member benefits, so yeah, check out the social media platforms around lots of the discounts. There is usually discounts on driving courses and C1 medicals and stuff, which we talked about earlier. Well, they're very beneficial normally, but obviously challenging currently. I think the main thrust of the questions are the anxieties around the uncertainties and the impact that it's going to have on people's roles, or people maybe not being able to step into the roles that they would perhaps want to. So some of them are quite specific, actually. Let me have a little look through and find you one. I'm a second year, limited placement, both first and second years, and no chance for simulation. Question how we can get signed off as well as feeling ready to qualify. Who would like to comment on that one? Vince, maybe?
Yeah, I think it goes back to what I've said previously about working with your education provider, and your education provider is in a similar boat to you in that this is all new. It is a pandemic, it's an emergency situation, and they're trying to come up with the most appropriate plans to get you through the course. What they have to do is make sure that anyone that gets to the end of their program to the point of being eligible to apply for registration with the HCPC has met all of the required standards. So you will be supported to that point. It might look a bit different to how you thought it would look when you started the course, but lots of things are going to change. There's going to have to be changes made within programs to get people through to the end. But do rest assured that when you do get to the end, you will have demonstrated that you've met all of the standards, all of the competencies, and everything that you require to go into practice as a registered paramedic. And that's the responsibility of your education provider to support you to get to that point. So make sure that you're giving them an opportunity to make those changes and listening to what they're telling you about how they're planning to get you through the course. And that is what they will do for you.
Thank you, Vince. I think maybe that there's probably some people that are joining and have missed some of the earlier answers. So, but it doesn't help to reiterate some of the points, I don't think, at this point. Ian, there's a specific question for you, sir. So do you envisage ECA recruitment for second-year paramedics continuing, or with the provisional C1 delays, would you recommend seeking other roles within SCAS, such as CCC?
I think this new world, as we move forward, will see student paramedics continue doing some of their temporary work well into future studies. And I think the ECA role, for instance, does offer a great opportunity for students to perhaps continue their work and studies together beyond this COVID period. We see that there is a temporary hiatus about students getting their C1. Once they achieve that, locally, it's our intention to continue the ECA training and support students to obtain their C1 and then continue with their driving education. So I think the answer is in two parts, Liz. Yes, locally, we would like to continue with that support. If students locally and I hope nationally consider that there are other opportunities of employment, bearing in mind that the working hour guidance that the college has indicated, then CCC is a fantastic opportunity and is slightly less frontline if there are individuals that are concerned with that face-to-face element that they'll see perhaps in either ECA or temporary paramedic NQP roles.
Thanks, Ian. I think that there is some uncertainty around the move from a temporary register to a full register. We don't know, do we, at this point, when that temporary register will cease to be in existence. We're told that it'll be when the government tell the HCPC that the state of emergency is over, but we do not know when that will be and how people will move over from one to another. So just to reiterate that those on the temporary register, if they maintain their student membership, at least they have our support and the fitness to practice cover representation for that move over. It's important just to keep your continuous student membership running right up until that point where you're eligible to apply for full membership with the College of Paramedics once you do actually come to a point of getting on the full HCPC register. So there's a lot of words there, but I hope that kind of makes sense. Will, do you have any further comment on that point or any other indeed?
Yeah, I'm just reading through some of the general comments, and there seems to be quite a bit of anxiety around what happens at the end of this temporary register, and you know, there's still going to be a requirement to complete your program and complete your studies. That's the bit that you need to do to join the full register. So the universities are working very hard to make sure that students can complete the program that they're on at the moment and progress into their first or second years and with as little disruption as possible to the duration of their studies. I've seen a few comments about will courses be delayed by months or even up to a year. I think there's quite a few questions that we don't necessarily have the answer to yet. I know one university has said this morning that they are absolutely starting their semester A intake in September. Some of that might be online. Some of it will be face-to-face as soon as they're open again. So they're waiting for the guidance to know when they will be able to start back to normal activity. And so, if you are joining the temporary register and performing a role now, excellent. We will try as the college, and I'm sure as the education providers, to keep you as up to date as possible about what next and how to transition from that back into your studies and then onto the full register. Some of those answers we just don't have yet. So as soon as we know, we will keep publishing a live Q&A document. Will be going up onto the college's website soon, and we will update that every day if we need to, with changes to the HCPC, to what the process might be in the future. As soon as we know, we'll try and get it updated and let you know.
We will indeed. Will. It's challenging, but we will try and keep everyone as up to date as we can. From a HE perspective and an employer perspective, Kaz, do you have anything else before we're coming to the final few minutes of the call? But I want to give you the opportunity to add in anything from a HE perspective.
Yeah, sure. So I can see from the comments that there's a lot of concern about what's going to happen with the Year 1 and Year 2 students and how they might be mobilised into roles to support this effort. There is a national process that has been put in place, and the HEIs will be coming out to you to ask for details of who's willing to volunteer, so that can then go on a national database. So that is coming. It is just going to take some time because they do have to prioritise the third year students first. And also, again, it is just to reiterate, people are concerned about completing their courses. We do understand that. But before this pandemic hit, there was a significant workforce deficit that was identified in the long-term plan. So we all want to make every effort that we possibly can to make sure people are completing their courses, so we're not increasing that workforce deficit. But it's very important to us that this is done in a safe and supported and coordinated way. So again, just please be assured that we are all working towards that goal.
Anything to add, Kirsty? Or
just to clarify, really, so HE have opened up a portal that the HEIs are asked to complete with all of the student details. As Kaz says, the HEIs will need to liaise with the students to enable them to do that. And then a process is initiated where individuals are matched to employers based on the responses that they give as part of that survey. And HE are trying to take the onus of the work away from the employers, and to ensure that the process is as safe and robust as it can be for the students. The emphasis being that these individuals are students, and the priority is ensuring that they complete their period of studies. But nothing really above and beyond what Kaz says. The idea is that the whole of this process is supportive, and it's supportive of these individuals as students.
Thank you, Kirsty. The final comments will be from Tracy, but Bob, a few final thoughts from yourself?
Yeah, we've had a little bit of feedback from our statement that aligned with the CAPO statement. And one of the things that people have picked up, particularly the ambulance services, is 60-40 split. The 60-40 split came from Health Education England, and this was the line that all allied health professionals were taking on getting the balance between being supportive to COVID-19 and the activities in healthcare, and also maintaining studies. I think each HEI and their employing ambulance service, if they are working, will have to find the balance for themselves. And ours is a guide. Really, the essence was we didn't want students to go out in full-time work. There was potential that one or two wanted that from ambulance services, and we were very cautious to have that approach. So it was really about getting the balance. Whether we'd said 70-30, 60-40, the essence is that you are a full-time student, and you still are a student even when you're out as an ECA. And so the essence from us is stay safe, keep in contact with the university. We will encourage universities to open up more dialogue with you. And at the same time, get through your studies and come out at the end of this, because we're going to need you for the future. Not only do we have 5,600 students currently in the system, there's probably going to be even more students coming in this year. And the plan in the long term for the people plan was to have anything up to 30% increase in paramedics. We are very needed at this very crucial time now, but we're going to be needed into the future in how the healthcare is developed. So spread the word, get more of your students to come and join us, and let's all work together for the best for both for the profession and for the wider issues of healthcare. Thanks for calling in today.
Lovely words, Bob. Thank you very much. There's one, hopefully, platform of support coming your way very soon. Hopefully on Monday, we will launch a website that's been put together by lots of educators from university and enthusiastic colleagues around the country, with Richard Toome from Sheffield Hallam University. So a platform that will give you some very useful practical tips on how to be paramedics, how to do the skills, how to draw drugs up, how to use the radio, some really basic practical skills. So look out for that coming to you on Monday. Thank you to the panel. You've been amazing. And thank you for the couple of hundred people that have been listening live. And I'm going to pass to Tracy Nichols, our Chief Executive, for final words. Thank you.
Thanks, Liz. Yeah, my thanks go to this amazing panel, but also thank you to you. This is the first time we've tried something like this. Our strapline at the college is leading the paramedic profession, and that means you. Please know that we are at every national table putting the voice forward. So please tell us, because we can act as the conduit for your anxieties and your concerns, because I can guarantee you the anxieties and concerns you have are the same ones we have, but we need to hear that from you. So thank you so much. Take care of each other, take care of yourselves, stay safe, and thank you all so much. Goodbye.